So this video, before John gonna share his experience with the audience, I'm gonna show the audience what John looked like before, and then after that he's gonna share his journey of hair transplant, I guess. And this is before. Again, I have a wide forehead and a receding hairline, and a year later, let's see how much higher on both sides. We lowered the hairline, brought in the temple as well. And the right hand side, left hand side, and brought in the temple quite a bit. And we could have bring a little bit more too, and that's my second project for him. And a year later. Okay, so John, the audience are yours. So if you can share your experience with us, that'd be great. So start with the beginning, how hair loss affected you, and then your research and those stuff.
Okay. I started to notice losing my hair in my early 20s. As everybody watching this video knows, losing your hair is not fun, especially at an early age. So from there I started doing a lot of research, probably starting around age 25, and really wasn't confident in going with anybody. I didn't think the technology was there yet until years and years of research on the Hair Restoration Network and just all over the place, and finally came across some YouTube videos and saw Dr. Diep's work, and luckily he actually happened to be located pretty close to me. So I mean, I was looking all over the place. I was looking in Europe, I was looking, different parts of the country. So found him and set up a consultation, and finally was confident that I was going to get kind of a result that I was comfortable with, because if I thought it was going to look mediocre, if I thought it was going to look like I had had work done, I wouldn't have done it. So for me, finding him has been awesome, and honestly, it's pretty life-changing. Just not only do you look different, you also just feel more confident, which I think is, equally as important, just how you feel about yourself. So the whole reason I decided to do this video is because I remember watching other people on YouTube really help me.
Right.
And so I just felt like I should return the favor.
Yeah, can you share with the audience how what surgery they look like, and and when's the recovery, and I know the job wise, and because the audience want to know that, and when do the hair start to come back for you? So
surgery day, it was a pretty long day. I got here at 5 or 5:30 in the morning, I think, and then I did close to 3,000 grafts. So that took pretty much all day. I was here from I was here for 12 hours, I think. There was points where I kind of felt the surgery, but I was fine. It wasn't a painful thing. Recovery, honestly, is a couple of days. It's kind of a haze, and then you just kind of go about your business. The first week is probably the hardest part, because you've got all these grafts in your head that you're trying. You gotta let them set in there, and then after that, kind of they start shedding. The first after a couple of weeks, you go back to work. I went back to work in a week. I just wore hats. There was a point where Dr. Diep said it was okay to start wearing hats. I did that, and they call it the ugly duckling stage or whatever, where your hair falls out. You've got a pinkish hue around here. It's not fun by any means, but totally worth it. And for me, I was able to wear hats, and I did. And Dr. Diep also had me do the A-cell, which is an injection that, theoretically helps you recover faster and have your hair start growing faster. And honestly, mine started growing, I started seeing things happen in about I want to say it was around 3.5 months, something like that. And then I'm at 7 months now, and I've been without a hat since month 4.5, and I feel like I'm lucky. I'm ahead of a lot of people in terms of how quickly it happened, but I'm extremely happy with the results, and I knew going in that I was probably going to end up getting 2 surgeries because my hair is blonde and super fine. And honestly, everybody I talk to right now says I don't need to do another one, but I'm kind of crazy like that. So
well, you're perfectionist, yeah.
Well, I guess.
Yeah.
So,
but you know, you were nervous at the beginning because you and I met multiple times, not just one time.
Right.
And the thing that worry you the most is having a bad hair transplant. It's not just a bad hair transplant, not just pore density, but the hairline that doesn't look natural for you.
Right. It doesn't look natural, but so yeah, I was nervous because not only, you know, you got to live with this head of hair for the rest of your life, it's also a big investment. But I would do it. I mean, obviously, I would do it again. I'm very happy that I did it. It's one of the better things I've spent money on in my life. So.
Do you remember the time you and I had to fight for the hairline?
I do. So I'm pretty conservative. I didn't want it to be like such a drastic change. And so we kind of came to a compromise on the hairline. So Dr. Diep actually wanted to bring my temples in a little bit more, and wants to bring my hairline down a smidge more. But I actually, after doing this, I trust him now. So I think round 2 will probably do more what he wants to do. But as of right now, I'm psyched about how it looks.
Right. I think technically, I mean, you look great right now without having to do another one. But once we at this stage, it's like you want to take another step beyond that, and you want to make sure that, hey, you know what? Why not finish the job? And again, you know, I never like to impose my hairline on anybody, and I always work with my client, and I want to listen to what their concern is, because sometimes I find out that the patient, when they put more input to their hairline, they tend to be more satisfied, and sometimes even many of them might go away from what I recommend. I still do what they want, but sometimes we work together to get you the best hairline.
Right.
But what I found out that most of the clients who not following my hairline end up going to come back to finish it, and that's not wrong. I mean, you know, and they say, hey, you know what? I'd rather be conservative, better safe, than sorry and have the hairline too low or too aggressive.
Sure, you can always go lower. You can't raise it back up.
Yeah, so. Yeah. So that's the right way to go about.
Yeah.
But being a perfectionist, I am. You know, and I mentioned in many of my videos, it's the whole artistry of creating hairline. You know, and it's important because you want to do it right. It's a custom work. Each person has their own unique agenda, but then their own facial structure as well. So I build around their agenda, what they want, and I build around the facial structure. Right. If they trust 100% what I do, then I'll do that. If not, then we work in between and compromise. And then once they see when it comes in, they can always come back and finish the job. And I'll tell you, even a smidget lower, and even a smidget bring it in the temple, it will completely frame your face, you know. You might not be Brad Pitt, but hey, you know, it will look nice. It will look nice. I mean, just turn your head to the left side for me, and you can see he has a nice profile, and the hairline is in, and it looks very natural. And if you can turn it all the way into the back so the audience can see, you know, this is 100% by FUE, done by me, and you can't see the scar and all this stuff. Okay, so go ahead, turn around. And again, John, can you look down? See, this is 7 months, and look up. And thank you for showing the audience what your full face like, and sharing your personal journey to the audience. So then hopefully they can understand what's the journey look like, and you know, and help them. And just like other video help you. Right. So thank you.
Thank you, Doctor.
Bye bye.